Hi, everyone. My name is Katherine Sanders from Sanders Consulting, and I'm here today as another installment of my series of conversations about the Surgeon General's framework for mental health and workplace well-being. And so today I have the pleasure of talking with Lisa Sirois. Did I get it right, Lisa?
Sirois.
Sirois,
Close.
sorry.
It's French.
Sirois from the Poverello Center in Montana. And Lisa, thank you for taking the time to talk with me. And I'd love to start by hearing a little bit about your background and your interests in workplace well-being.
Yeah. So my background is primarily in houseless response services. I was calculating recently. I've been kind of in social services for about a decade now, which is kind of amazing to me. But and I started primarily doing kind of direct care work in a homeless shelter. Um, and through that time, I think about 2.5 to 3 years in, I myself burnt out pretty significantly and needed to take a step away from the work. And that really developed a desire or passion for me to ensure people have the support they need to do this difficult work within just social service environments, but particularly in the houseless response field. Um, so therefore, during that time, I was getting my master's in social work, and kind of was working slash returned to the work after. And currently, I work at the Poverello Center as the director of programs. So really overseeing our different programs for the facility. And in that role, I feel one of my primary duties is to ensure my staff feel prepared to accomplish the work they need to every day. And that really encompasses the whole person. So, employee wellness is really important to me, and I'm always thinking of new ways we can bring that to the POV and try our best to help folks because this work is really hard. Work in general is hard, and we're human, so we definitely have our own responses, whether related to the work or the home life. And there's always new and unique ways to think about how we can support each other in that work.
Yeah, I really, you and I have had a pre-interview conversation, and I really love your story. That you were doing the work and then had this experience of becoming exhausted and then went back to school and became, got your master's in social work, right? And
Yeah.
I just love talking with and collaborating with social workers too, because I think it's this like focus on systems. So social work focuses obviously on family systems, community systems, large scale social systems. And since I focus on work systems, I feel like there's just a synergy there.
Mhm.
I get it, and you guys get it, that this whole thing is connected, and there isn't just one place we need to intervene. There are multiple places that need to be addressed. So I think your story is really interesting. And would you feel comfortable sharing a little bit more about what you learned through your experience, becoming exhausted by the work itself that brought you to this place?
Yes, yeah, definitely. That's something I definitely carry, even with all my staff. I'm very open about my experience, so that way, hopefully, it encourages others to be open as well if they get to that place. Um, so yeah, at that time, I was doing kind of like just direct care work, working day to day with people in crisis. Yeah, it just started to drag on me. And I remember coming onto shift and especially towards the end, I might come in and have to just like take a breather in the bathroom and I would be like crying in the bathroom being like, how am I going to do this? I need to keep doing this work and just really struggling to control that. And thankfully at that time I was comfortable enough in my workplace to tell my teammates like, hey, I'm struggling today. I need you to step it up because I can't. Whereas I know not many people have that comfort in their workplaces. And it just, yeah, it was kind of, I thinking of systems, an early warning sign for me when I'm starting to recognize I'm getting a little tense or a little stressed out is when I start to kind of want to tear apart the systems. I get a little angry, frustrated, look at blame in places that I might not normally. So there's definitely a lot of that, just like not very positive thinking on like different roles in the facility or different realities and how this work plays out and can really drag on people. And in that, a lot of learnings that came out were so much of it comes down to boundaries for me and like really trying to identify what boundaries I need in place to be able to do this work and have it be sustainable for myself. So things like when I'm off, I'm off. I'm not doing work at all, or making it clear to my teams, like, you can get a hold of me, but if I don't answer, it's because I'm off the clock. um, or like being clear of like, hey, I'm heading home early today. I'll be available until 5, but after that time, I'm not. Um, and there's so many different ways, even with the way we interact with those we serve or our colleagues, like being clear in the workplace of what is too much or what is not appropriate, and just making sure you speak those truths. Um, and also doing the internal work to figure out what that is, because you might not know yourself until the line has been crossed a lot. So a lot of different learnings there and continually learning. I think I'm regularly trying to think of new or identify new boundaries or new healthy life patterns that I need or want to engage in to keep the work sustainable. Because you think you have it and then something else, you get tired, we're human, and you're like, okay, back to the drawing board. Let's see what is impacting me now and how can I keep going forward with this if I want to. Because I think I've had very authentic conversations with myself and my team about like, hey, this work is not for everyone, or sometimes it does take a toll and you need to step away, and that's okay. So a lot of introspection and open communication with everyone about, you know, how the work is impacting you and what you need to make it healthy for you, whether that's maintaining in the work and staying in it or potentially stepping away for a little while. It can really go many different ways. Yeah.
I love it. Thank you. I'm going to share the Surgeon General's model here, and it kind of as a segue into what you were just talking about, right? About which of these parts of the model might speak to you and why. So I think they probably connect also to your personal story, but now also as your role as a leader in your organization. So
Yeah. I mean, so much of this really does hit on what I feel is needed in a workplace to um, feel safe and supported and to feel like you can succeed. I think, let's see. Well, in my in my field, safety and security is definitely huge. I think we're managing folks with a variety of life experience that sometimes can come out in unsafe ways. So that's just front and center all the time for us. But really, yeah, it's like I can go around the circle, like social support, belonging. I think if you that's something on my personal work journey in different places I've worked. When I don't feel like I belong, or like feel really connected to the work, so kind of even the meaning for mattering at work, like I quickly start to diminish my ability to engage in the work. So I kind of I need that piece, and can see why a lot of people might benefit from, what they call workplace culture or social support, connection, whatever that might look for them. Um, and then same thing, like flexibility has been huge for myself and even some of my staff, especially when you're trying to work with folks from diverse backgrounds. I think you need to be really realistic about what type of flexibility is needed for folks, and help them know like you can take a day off or go to a doctor's appointment, and that's not going to put your job at risk. I think I've worked with a lot of people who yeah, it's like they tiptoe around that initially, clearly due to some previous experience that wasn't positive. And it's a lot of just reminding folks like, no, you're human too. And we want to work with you. And life happens. So sometimes you have to take care of that, and that's okay. Um, yeah, and again, you just go all around dignity and meeting. It's like so important to feel like you're valued in the workplace and like your ideas and thoughts matter. And then again, like being able to grow there. I think that's something that's also like for me, if I get really monotonous with my work, personally, that I start to, again, get a little zoned out. It doesn't engage me as much. So the ability to just keep learning and growing really helps to keep me engaged. And I found that with a lot of my staff too, who just kind of hop on each new opportunity that's available to them. And you can really see the benefit that it brings to their experience in the workplace.
Awesome. So Lisa, I know that you guys are doing a lot of cool things. You have uh, uh, multiple locations and you operate 24/7, right?
Yes.
365 days a year.
Mhm.
So I'd love to hear a little bit about, um, the things that you've tried and how you feel about them, to improve employee well-being at work and in whatever directions you want to go. Things that you maybe have tried that haven't worked so well as the things that, seem to be gaining traction and you feel good about, and things that you might be aspiring to do in the future.
Yeah, totally. I think we're always thinking of new ways to engage and support staff. And we've grown so much as an organization in the past 5 or so years that in that both brings its challenges, but also its benefits to have more support to actually um, provide support to staff in ways that we maybe hadn't before. So kind of two of the big things that come to mind. Um, it's been lovingly termed Lisa's self-care corner. But I think maybe 6 to 8 months ago, during our all staff meetings, which are monthly, I've started doing some like self-care resilience burnout prevention education based presentations to our staff, really kind of small snippets. So it might be anywhere from 15 to 20 minutes of me just doing some of that education, and hopefully sometimes resource tools. And for me, I see it very much as my job, but it's not like it was a duty that I like signed on my job description. It was just a need that I was like, we need to do something. And just start the wheel here so that way there's some education there. Um, and that's been a really exciting thing for me personally because I have such a passion in it, but also hearing from different staff that they do find a benefit in that resource. I understand that not everyone's going to engage in that material, but I'm always excited to offer the education piece, and maybe someone doesn't pick it up that day but they go back to it later and find a benefit to it. And yeah, some weeks it's just like a breathing exercise. Actually later today I'm doing some stress reaction education on like how our bodies and minds respond to stress. um, so it's just like an exciting way for me to learn more. So actually I think I stumbled upon this new framework in some of my research in starting that. I was like, oh, this is a cool tool. Let's see what other resources are out there. Um, so that's something I'm pretty proud of and excited to kind of keep trialing and tweaking. And I always invite other staff to bring their opinions and insights in to that conversation. So if they have something that benefits them in feeling resilient in the work, I want to be able to then take that and share it with the rest of our staff. Um, an additional thing that we're trying, we actually just started it this month. We've been kind of working on it slowly but surely for a year, is a processing group for our staff. So because of in our environment, they do face a lot of stressful situations. We think it's really important to give staff the space to be able to talk about that work in whichever way feels good for them. Especially because it can be really hard to talk about our work with folks who are not in it as well. It's similar, I often feel like similar to kind of frontline workers where you really only get it when you're in it.
Mhm.
Um, so we are trialing this program that will have 2 groups a month, at different days. So again, because we are 24/7, 365 in different locations, we're trying, like an early morning in the beginning of the week and maybe in the month, and then an afternoon towards the end of the month and towards the end of the week to hopefully have it be accessible to staff who are on different schedules. And also we're working in partnership with our like HR team, our people and culture person to ensure that like we can fill shifts. If someone is working already but wants to go, we try to make it very known, like you can still go, you just need to let us know so we can get someone else to fill your shift for that hour to 2 hours that you may be at this event. Um, and it's been exciting because we've done versions of this in the past years ago, where at that time we were working with a clinical social worker. And the group eventually became a closed group, which was good for the individuals within it. But then it kind of cut off that resource to any others who might want to enter the space. So our hope with this group, we're actually working with a community chaplain. So it's
Mm.
a woman who really just works with the community. She's provided supports when we do memorials for clients who have passed away, and is really open to anyone's spiritual background, and really is focused on helping people make meaning out of their lives in whatever way that is. So we've been able to build rapport with her for a good couple of years, and are excited to kind of bring her into this space where she can continue to be that support for staff in a very open and not non-judgmental way. Um, so those are
So,
like the two big things
so
right now.
before we
Yeah,
move on,
yeah,
I have so many
yeah.
questions, Lisa. So, because
I
it's
know.
so awesome. So,
Yeah,
first to go back in time to like the first version of the um processing group.
yeah.
Was that around a critical event? Is that why that started? Was there an event that brought, people into this
Yeah.
conversation and that's why it became a closed group? Is that, or how did that happen?
I I honestly can't remember. I was there, so it was that group started shortly before I left the first time from this organization when I burned out. And I remember being at the first couple. Um, and what I imagine is that it was maybe a culmination of different events and just kind of a similar awareness of, oh, we need to provide a space. My understanding currently is that it became closed to kind of help people feel like they could share in this really a non-judgmental open space. And sometimes when you have people come and go, depending the individual, that might kind of change the tone of the room. So I suspect that was the decision at that time. But we have explored models like that. Like we've had Courtney, or the person who is doing our processing group now, come in when there is like a critical incident just to be available,
Mhm.
should staff want to talk to her. So that's definitely a real piece of this puzzle.
And
Yeah.
like you kind of alluded to earlier, I think a lot of first responder, organizations like EMTs or firefighters
Mhm.
might also, or police, I don't know if police do it, but I know EMTs do it, have someone come in and do a processing thing around an event, right? But then
Yes.
it's sort of like event specific. And
Hmm.
so this new version that you're inventing with your chaplain is sort of like, um and this is my language, you're like making it part of the norms of this is how we work. We know we have these conversations about the impact the work is having on us and the meaning it has for our lives. I mean, I think that's really amazing, and it reminds me of in healthcare there's something called Schwartz rounding, and I think I mentioned this to you in one of our early conversations,
Yes.
that where you have these workplaces where there are critical events that happen in a normal working world, right? I mean, so in
Hmm.
healthcare people pass away. That's part of what it's like to work in a hospital. And so it's like it is kind of, as an engineer, what I'd say is it is amazing to me for how many years we ignored. My mom worked as a nurse her whole career. And when I talked to her, she was with a lot of patients when they died because she was in the coronary care unit. So very, very ill people.
Yeah.
And I asked her, well, so like, did you ever talk about it with, the other nurses or physicians or, assistants? And she's like, no, you just cry about it in the car on the way home. That's the job. And,
Hmm.
that's so unfortunate, right? Because it's so predictable that these things are going to happen. And yet we don't usually, or we didn't in the past, make time for employees to
Hmm.
actually absorb it and make meaning of it and try to heal from it.
Yeah. Yeah, definitely. And I think it's like classic story of like stigma around talking about these things, right? Like we're in a better space now. But it's so easy to just like, I'll deal with it myself and walk forward. And that actually reminded me of a training that myself and our shelter director went to earlier, well, late last year. Was a CISM training, which is critical incident stress management. And it is primarily for, first responders, kind of fire, police, who are responding to these really critical incidences, car crashes, plane crashes, etc. But we went, because we do see pretty significant issues happen, or we do see deaths on site on occasion. We went to this training hoping to get more tools to then bring back and help with similar processing. So we're still kind of learning how to best do that in our own way, but we've started implementing that after a critical incident. Myself or our shelter director might come in and ask them of those questions, just encourage people to talk about it, voice the incident, and kind of get some of that processing out of their own mind, to kind of help that process move forward. And it's been a really helpful tool to help us feel confident in what we were doing before. It was like, okay, we can say, yes, talk about this. What did you feel? What did you see? And that's not going to like further traumatize someone. So it was really cool to go through that training with our framework in mind and think about, okay, how do we apply this to our environment, and ensure we can help staff when they see these really traumatic or unfortunate things happen, knowing that we all respond in different ways. So that's been a really cool tool to kind of start digging into. Yeah.
And I want to go back also to the new processing model where people can, say they want to attend, and then even if they're on duty at that time, it's their shift, then somebody might fill in for them. Are these virtual meetings, or do people physically drive to one location, or how is that going to work?
Yep. So right now we're trying in-person meetings, and we've been trying. It'll be interesting to see where we land with it, because we're trying to find locations that are off-site from any of our locations to kind of give some separation, and ideally places that feel a little bit warmer, which is hard to find. I think we've tried to be really intentional about like, maybe some people won't feel safe or comfortable in a church basement, but this other environment looks too clinical. So we're really trying to think critically about that piece. But at this time, it's offsite, and that's actually a good example in thinking about accessibility. Both of the locations we are trialing this month are in our downtown, Missoula's downtown area, and therefore we do have to think, oh, okay, people might have to pay for parking. Is that going to be a barrier for someone? Little things like that. But we're like, well, let's try it. We'll see what happens and go from there. But yeah, so that's always kind of another piece that we're thinking about.
So when we think about this particular new offering, how would you like, if it was successful, with the air quotes around it, what would that look like? Like, so how will you know if this is doing what you're hoping it'll do?
Yeah. There's a couple of different qualifiers. I think I'm someone who is like, give it a chance as long as we need to. And if one person has a positive experience, it's worth it. And I know we're in a work environment where we did find a grant to help us, be able to support the person doing this work. So sometimes you need to kind of prove that it's working. But I think my hope is that, like some staff will just start to go, they'll kind of hear word of mouth. Oh, this was actually a really positive experience for me. I was able to talk about X, Y, and Z thing from the workday, or just my frustrations about the employer. I'm like, talk about anything, get it all out. And then hopefully one more person will go. And that will just hopefully build a culture of like, we can talk about these stressors and don't need to feel scared or weird or concerned about bringing that up. Or feel like we're weak because we can't handle it. Like, I want to try and really get to a place where we're like openly talking about like, this work is really hard. And that's okay. It just means we need to all figure out how we're going to keep in the work if that's what we want to do. So for me, success is just that people start to engage in whichever way is good for them. And thankfully, how we're approaching this right now and the funding we got thankfully doesn't have a lot of reporting requirements, which is really nice for this kind of work. We're not really tracking anything. We don't need to know who's going to the groups. I think we might ask the person running them to give us like a number. So that way that gives us a heads up in the future of, how many people are engaging. But we really want staff to know like this is a safe, private place that you can go to, and we leadership, whoever, doesn't need to know that you're there unless you want to share that information.
So you won't
Um,
attend yourself?
well, we're actually trialing that too. So I was talking with my kind of co-lead who is helping kind of support this process. And we want to try and have it be like not hierarchical. So we are trying to have it be an open space for everyone. So I actually did go to the first one. As I talk about always relearning our boundaries, I've been a little crispy lately. So I've been trying to kind of get back to a better place. So I was like, you know what, I'm gonna go and really in that space name like, hey, I know I'm in this role, in this position of power. And basically say I can leave at any time if that would make someone comfortable, but if they're okay, I will engage in the process. So really trying to be intentional about if I'm gonna go to that space, it's because I have work related things I need and want to process. Versus so showing up authentically versus showing up as a leader because you're like, oh, I need to make a face and show that I'm here and supporting this.
I
So
need
really
to
trying to
count how
be
many people are here.
exactly, yeah. So trying to engage in that
Mm.
space for its purpose and not to kind of put a show for leadership's engaging in XYZ way. And I've kind of talked with our other directors and invited them in that same way of like, hey, if you need this space, it's for you as well. And please come. And if you don't, that's okay. And because we're offering 2 a month, I'm also thinking about the future of it. And it's like, okay, maybe the first group of the month is a space where director level staff are able to attend, but maybe the second one in the month is more like open to non-direct staff, director staff. And really only if that's what staff want. I think we're hoping to send out like a survey in a month or two to kind of get some more clarity on like, how is this space working for you and what would make it better? And that might inform kind of the future of the space as well.
I
Yeah.
wonder if the chaplain might be able to ask the people who are attending some of those questions too, right? And surveys are great. And if the chaplain's really connecting with the people who are attending, that might be a richer source.
Totally.
Yeah.
Yeah.
But I also love that there could be multiple reasons that this is supportive, and that you do have the multiple locations. And so if I'm at one location and I go to this offsite place, and then I'll meet people who also work for the same organization who I might never meet otherwise, right?
Yeah.
So I think the opportunity to make more friends or feel more supported or meet other kindred spirits, I think that's also really wonderful.
Yeah, it's really exciting for me. And I think even so we had our first group and it was quite small, which I expected when you start something new. Usually people kind of trickle in. But even in that moment, for those of us who were there and sharing, it was so clear to me. I'm like, we're all dealing with like the same issues. And like, let's kind of give ourselves a break and not think, oh, it's just me, or oh, no one can know about XYZ thing. Because at the end of the day, no, we're all kind of in it and trying to manage as best we can. And we should be trying to lean on each other if that's what the other person is open to, right? So I'm excited for, yeah, that deeper connection that can hopefully be found by those who want to engage in that group. Yeah.
That's really wonderful.
Yeah.
So, Lisa, are there other resources or any other guidance that you would give other organizations who are looking to start improving the well-being of their workplaces?
Yeah. I guess specific resources. few are coming to the top of my head right now. But I think just being really open to creative ideas is really important. And really trying to get the voice of your whole team in on that discussion. Because, and I tell my staff this all the time too. I'm like, if you don't tell me what's going on, I don't know. I don't know what's going on. So I can sit here and assume everyone needs XYZ thing from my own experience. But that's just my experience. So I think it's really important to listen to your whole team and like find out what truly helps them feel valued in the workplace, because it is different for everyone. And understanding that like sometimes people aren't going to want to share that, and that's okay too. And you have to be willing to do some trial and error on things, and just give it a chance and be comfortable in the uncomfortableness. I think I joke with my teams as well. It's like, I'll sit here in silence. That's fine with me until someone will chirp up, right? So I think it's a lot of just really being open to what may come out of it. And yeah, researching different tools, and it will look different for each work environment too. Like I think my partner and I talk about, we're both in nonprofit work, and we always talk about nonprofit management. But he's in the conservation field, and we have some overlap, but we're definitely, how I come to work and need support at work looks very different from what he needs, because I'm working with people and he's working with land. So it's just each place will look different, and how that support is needed and what people really want in their work environment, in the means of support, just based on how people come to work every day. Yeah.
Yeah. Well, thank you. Thank you so much for taking the time to talk with me about this. And thank you for all the important work that you and your colleagues are doing. I'm sure that other organizations will learn a lot from the things you've been experimenting with. And then, of course, one of your people, Caitlin, is one of the other people that I interviewed for this series, right? And so between the two of you and what you've been explaining, I mean, you guys are doing a tremendous amount of innovation, I think, in your center, and I'm really impressed by it. So thank you for taking the time to talk with me, Lisa.
Of course. Yeah. And thank you as well.
Okay, take good care.
You too.